When your surgery is complete, you'll be taken to recovery, also known as the post-anesthesia care unit. You'll rest here, anywhere from 1 to 4 hours, as staff waits for the spinal to wear
How
off.
your spinal's doing, if you can wiggle your toes for me. Just a little bit. Okay, so your spinal's working well, that'll keep you out of
The nurses in this area are all specialists in assessment,
vital signs.
experts at recognizing how well you're coping with your operation. They'll be taking your vital signs, things like blood pressure and temperature, every 15 minutes, and asking about your level of pain. They'll also check the dressing on your hip to make sure there is no excessive bleeding or unusual drainage.
That looks good. I'll just get my pad here. I'm just going to put a little pad underneath.
When
Okay,
they're
so you come
satisfied
back.
that you're ready, they'll give their permission for you to be transferred to the ward,
Things okay?
where you'll be spending the rest of your time in the hospital.
Good morning, Sheila. How are you feeling?
Not too bad.
In your hospital room, your nurse will check on you regularly, taking your temperature and blood pressure, as well as monitoring breathing and heart rate.
This morning? How's your pain?
All of these are measurements that indicate how well you're progressing.
Good. You can lean back down. And I'm just going to take a listen to you.
The initial dressing on your hip will be large and bulky, but after they're sure healing is proceeding as it should, the nurses will change it for something smaller and more comfortable. Your dressing may be changed a couple of times before you're discharged.
Good morning, Sheila. How are you?
Fine, thanks.
The amount of pain a patient experiences after surgery varies greatly from person to person.
As you're lying
A
here,
pain
what number
nurse
would you-
may
what
visit
number
you
would
while
give
you're
your
on the
pain as
ward.
you're lying here right now?
It is important that you tell her exactly how much pain you're feeling. Then, in consultation with other members of your healthcare team, she can recommend the right medication for you.
Or working for you?
Good pain control is essential for your
Nausea or
recovery.
other side effects?
You'll sleep better, and it will be easier to walk and to do the exercises that ensure a good outcome. It's important to get your new hip working as soon as possible after surgery. That's why every patient will work with a physiotherapist to make sure they're doing their exercises regularly and correctly.
Just like that. And how does that feel?
Now, make no mistake, it's going to hurt, especially at first.
Repetitions of this. And then just gently
But
let
doing your
both knees
exercises is
up.
absolutely necessary if you're going to get the full benefit of your new hip.
Lift your bum off the bed.
No exercise you'll be doing will damage your implants. So if you're conscientious about the hard work you need to do, you'll be surprised at how quickly you'll be up and around. Once you're medically stable and your pain is under control, how soon you'll be discharged depends on your ability to do the basic tasks that will let you live independently while you complete your recovery. Before you can leave the hospital, you must show that you can walk far enough to move around effectively at home and that you can get up and down stairs. You also have to be able to dress without breaking your precautions. Most importantly, without bending forward more than 90 degrees, as well as being able to go to the bathroom and get in and out of bed. Even when you're physically ready, you still can't be discharged unless someone with a suitable vehicle comes to pick you up. Be sure to tell this person that he or she should be available as early as the second day after surgery.